Hello everyone, welcome to our channel. And today I'm joined by Dr. Prakash,
Namaskar.
our HOD. And today we are going to talk about a very serious matter. This topic is very important for our future. On our 77th Independence Day this year, our Prime Minister Narendra Modi have proposed an idea of a developed nation on the 100th Independence Day. They have planned an agenda to make our nation developed on 100th Independence Day, which is on 2047. So, sir, what do you want to add something about it, or what are your views? Can India achieve those goals till 2047, and what challenges will come?
Right, Arun, as you said rightly, our Honorable Prime Minister has set an ambitious vision for
Yes,
the nation which involves making India developed nation by 2047. And it's not too far away.
yes,
We are
sir.
not talking about 100 years time frame. We are not talking about 50 years time frame. It's just kind of 25 years and we have to prove to the world that we can achieve it. Is in this very month when Chandrayaan 3 has landed on moon
Yes, sir.
and we are literally on moon.
Yeah, and
And
congratulations everyone for that.
yes, so with this now, it's on every one of us to be world class. One of the beautiful thing that I liked about one of the speeches of our Prime Minister when he said that to make India a developed nation, everyone has to work in a way that we make our country really proud. To
Yes, sir.
do that, we have to be world class, nothing less than world class with work. Now, being public health professional, the challenge that is before us is to make the health outcomes, and mark my words, health outcomes, number one across the globe. When I'm saying health outcomes, it's a little different from health infrastructure.
Yes, sir.
Being young, we need to find out of the box ideas how we can improve the outcome. We are conscious of our total GDP size per capita. We are conscious that we cannot at all afford to spend healthcare budgets in the tune of America. If you compare with America, so roughly around 70,000 rupees every individual spends on healthcare.
Yes, sir.
Now this is really much more compared to India. We can't really imagine to spend that much.
Yes, sir.
For that, we have to devise very Indian ways, very local ways to deal with public infrastructure and local solutions to come up with absolutely wonderful outcome. For that, I have mentioned in my book also, we have to create pedagogies. That's the educational curriculum in a way that children are provided with absolutely wonderful health lifestyle
Yes, sir.
right from the childhood. If we encourage children to take right nutrition, get into field activity, exercise, like our Prime Minister mission is there, Khelo India.
Yes,
So
sir.
our Prime Minister is very actively encouraging Indian students and kids to participate in sports.
Yes, sir.
Now, creating a culture of sports, creating a culture of healthy eating, creating an environment where there is always an opportunity to move around.
Yes, sir.
With this, we can create a citizenship which is healthy, and at the very first place, we can work on the triad of public health, which is prevention, protection, and promotion, in a way that we stop diseases in the midway. We don't allow the diseases to take place.
Yes,
We
sir.
have to work on reversal, but reversal is a very costly way of treating and managing the diseases. If you look around in public health, if you see Japan, so it has big aging population and struggling with manpower to support its aging population.
Yes, sir.
Europe is struggling with the same. Now America is also suffering with the same. In India, we have got young population, but imagine after 30 years or 40 years when our population will start aging,
Yes, sir.
the kind of large number of population we'll have of people who are aged,
Yes, sir.
who need support. Now add to that if they have immobility diseases like arthritis or other conditions which create immobility. Now with that, it will be extremely difficult to deal with health condition. So we need to create, as public health professionals especially, we need to create right educational inputs which create a specific change in the lifestyle right at the student age.
Yes, sir.
And that's going to make an impact and create the very foundation of right health in India.
Okay, sir. But sir, whenever we talk about developed nations, many people think about America and Canada and other countries which are really developed. But when we look at our country, like India looks ages behind those countries. So, do you think this goal is like possible? Like 2047 is very near. So, is this goal like really possible for India to achieve, or will there be many challenges, or will we not be able to face it at all? Like, will we not able to complete it at all?
Wonderful. To look at this question, we need to understand and we need to look at technological history.
Yes, sir.
Like if you talk about mobile phone, so before mobile phone, the era was of wired telephones.
Yes, sir.
So even America took more than 50 years to make telephone available in each household. But with mobile technology and the kind of fast pace we are leading the mobile infrastructure, almost we have done 100% coverage of mobile phone in much short duration in India than even in the developed nations.
Yes, sir.
Our mobile connectivity and spread has been really fast. We have taken less than a decade to cover the density of population which took America decades.
Yes,
4 to
sir.
5 times more time was taken by America. Same way if we talk about other infrastructure, like if we talk about roads, past 1 decade we have added more roads in India than was created in America some 50 years back. So this,
Okay, sir.
with the advent of technology, it is easier to expand things in a very fast way. The banking development, if you look in India, now India has achieved 100% reach of bank to its citizens. This is much better if you compare the history of America and Europe. And you will be surprised to know Europe took it more than 200 years to cover banking to each and every household, which India did it just 2 to 3 years.
Yes, sir.
So our speed and our outcomes depend upon what kind of efforts we are willing to make,
Yes, sir.
what kind of sincerity we are going to put in our efforts.
Yes, sir.
With the present regime, if you talk about some public health achievement, you find that with right kind of intent, we have been able to achieve human defecation free India. That means government was able to create toilets in almost every household.
Yes, sir.
Government is very actively pushing water infrastructure. So potable water is also being made available to almost every household, which was in earlier generation, even in Europe, America and Canada, was made possible in more than 100 years. What America and Canada could achieve in 100 years, we have achieved, whether it's about scope and reach of water, whether it is scope and reach of mobile phone or banking
Yes,
or
sir.
toilets, in less than 5 years. What we achieved in 5 years, it took America's, Canada's, and Europe's to achieve more than 100 years. So that way, now if you have the right intent, we are living in an era and a generation where technology is really, really advanced. There is a large chunk of population in India for which the first mobile experience was smartphone.
Yes, sir.
The first
Yes, sir.
mobile, first phone technology they experienced was no wire phone, no dial phone, but it was straight away smartphone.
Yes, sir.
So now imagine with this kind of infrastructure, it's limited only by our ambition. If we are
Yes, sir.
ambitious enough, we could achieve. Like if you look back, just 5 years journey. So we have made water available, tapped water available in almost all villages.
Yes, sir.
100% electrification has been achieved in past 5 years. 100% toilets are now available in 100% household.
Even roads, sir.
Roads. So that way, the kind of number of roads we are adding, past 10 years, we have added more roads than was created in past 65 years.
Yes, sir.
If we talk about medical infrastructure, more seats have been added to medical colleges and new medical seats have been available than it was available all through the independent India in past 10 years. So
Yes,
if
sir.
you have right intent and if you are willing to work really hard, and that's why I say there is a great role and scope for young students and professionals like you to be ambitious, see the dream, and achieve those dreams. And public health, it is possible. Arun, can you imagine India saw more than million deaths because of malaria? And now
Yeah.
we are sitting right at the cusp where we are looking to eliminate malaria by 2027.
Yes,
Can
sir.
you imagine?
No,
Can
sir.
you imagine a positive situation that we had departments after department to control AIDS in every state, and now those departments are being converted into controlling other diseases because we don't have enough number of AIDS patients to justify the number of people who are manning the position. And at one time, it was imagined that India is going to face one of the worst human tragedy because of HIV.
Yes,
So
sir.
the kind of achievements we are making, the way tuberculosis number also are getting under control, the way you have seen and you have worked in Anemia Mukt Bharat project,
Yes, sir.
the way we are getting ambitious, we are dealing with mothers to treat anemia, that's unprecedented. The To you and to all the youth, I would like to talk about that the present challenges of India. If you read the books of economics, it was more by the loot than any problem in Indian population.
Yes, sir.
Economists, by their conservative estimate that there is a great research paper by Usa Patnaik from JNU. So she had said that more than $45 trillion was looted from India, and on that loot was created London and all the big cities in United Kingdom. And the same money was invested in America also, and American infrastructure came.
Yes, sir.
Now, since it's democracy in India and it's very thriving democracy, and we have got responsible leadership, no ambition is big.
Yes,
You
sir.
have to see the ambition and you have to be sincere, work hard, every dream is possible. And I'm very much hopeful this is possible right within our ages, right within our lifetime.
Yes, sir. As we know, India has achieved very great things in last few years. Either it is in public health sector, and even Chandrayaan 3. It was a very huge achievement for India. Like, and India was the fourth country to ever set foot on the moon. And now we are even planning for the sun, which is very great. And sir, there is one question. Like, this is not only from you. Like, this is from every single person in this country. Like, there are many examples of developed countries, but as a public health expert, how do you envision India as a developed nation by 2047?
Wonderful. I would like to say that the foundation of public health greatness, and I want not just India being developed nation, but I want India to become a great nation, a
Yes, sir.
source of inspiration for other nations. The way we have been all through our history, if you remove the history of past 1000 years,
Yes,
we
sir.
have been leading in science and technology and healthcare, and we came up with world class science of healthcare that's called in Indian indigenous language Ayurveda, the science of life.
Yes, sir.
And through public health, I want to achieve a dream where every Indian lives to its full potential, where we don't just look at being anemia free or malaria free, but we live to the happiest best, where we live a life where we fulfill our family ambition, which we are able to raise every child to its full potential, where as a family we are able to take care of our adults,
Yes,
where
sir.
we are able to live a healthy life which is absolutely conducive to our best of human potential. And that was really the ambition of Ayurveda.
Yes, sir.
Ayurveda always suggested we need to stay in a state of life where there is utmost happiness. We always talked about right ahar and vihar, right diet and right way of recreation and entertainment.
Yes,
So
sir.
our life is about the highest ambition, and that ambition is to live our life to the full potential. We may have different bodies, but every life is a bloom where it has got a potential. And if every life is able to bloom like its full potential, we'll be saying that India has become a great nation. The way it was envisioned in Ayurveda, the way it was envisioned in our philosophy of Vedanta.
Yes,
If
sir.
we live our life to the maximum potential, that's our dream and that's my vision. And I think with our public health effort, we will be able to achieve this.
Thank you, sir. And many people are planning for 2047. Many people are like praying for 2047 and many people are doing very hard work for 2047 to make India a developed nation. And thank you for everyone to watching this video. And I hope you guys also get a little bit inspiration or anything and do a little bit hard work towards India, towards our country. And it would be much better if you join health sector or any sector which helps our country. And thank you everyone for watching this video, and thank you Dr. Pranav sir to be in the video and guiding everyone towards 2047. And with that I say goodbye to Dr. Pranav and everyone, all of you, and thank you for being here.